Okay, today is July 15th, and my name is Rhonda Myers. I'm presenting this community nursing project. Come on in, please. And this is some of the literature that we're going over. I don't know if this can get a close-up here. Heart failure information, living with heart failure, another pamphlet on heart failure, sodium and heart failure, eat more, weigh less. This is a diet guide that is part of the DASH diet eating plan. Here's a low sodium cooking pamphlet flyer. Here's a blood pressure frequently asked questions. This one is from the National Heart and Blood Institute, and it talks about normal ranges of blood pressures. This one is about coronary artery disease. This one is from the World Health Organization about BMI and overweight and obesity. This one is about smoking cessation, quitting smoking tips. And this one is from the VA, and it's a heart failure management handbook to be used at home as a resource guide for those with heart failure. And we will move the camera over here. This is some of our participants here. Thank you very much for participating today. I really appreciate your time. Thank you. Oh, and we'll hand these out, please. This is toast to everyone. And one form that I did to mention, and this is the evaluation form after the presentation is completed. Okay, and today the topic is heart failure, and the purpose is for me to empower all of you, because you are either patients or family members caring for those with heart failure. So I want to give you as much information as I can. And I have a PowerPoint set up here, and this is talking about taking care of your heart. And the goal of this is to prevent exacerbations, heart failure exacerbations, to prevent illnesses, to prevent hospital readmissions, and to reduce cost. Annually, there are 5.1 million in the United States diagnosed with heart failure. Heart failure is also known as congestive heart failure, and it is a chronic disease. There is no cure, and it occurs as when the heart is not able to pump oxygenated blood appropriately through other organs in your body. It's a debilitating disease, and if unmanaged, exacerbations occur, and then that's whenever the hospital readmission rates go up, and chronic illnesses, and a lot of time financial ruin can happen because of underinsurance and resources. The goal of this is to improve patients' health and to sustain wellness. There are over 1 million ER visits annually that occur related to heart disease. 30% ends up in morbidity rate in those aged 65 and over. That's according to the Centers of Disease Control statistics. And approximately half of those will expire with heart disease 5 years after their diagnosis. And a projected cost to our nation is $32 billion annually. That includes medications, missed days of work, and healthcare services. Excuse me. We want to discuss heart failure, and like I said, it's a chronic disease. Let me go to the next slide. Sorry. According to the American Heart Association, 1 in every 33 persons will have heart failure by the year 2030, which equates to 8 billion people in the United States. The projected cost of heart failure in 2013 is 21 billion, and then that cost increases and evolves to 53 billion in the year of 2030. And part of those increases, of course, are due to technology of improvements in testing resources, but the geographical areas where it says that higher rates of heart failure occur in central and southern central and southern states appear to have the highest percentage of heart failure in the U.S. It didn't really say if that was according to their culture or their diet or their economic
all that
reasons.
good southern cooking, all that grease and butter and
yeah,
all that
all the
stuff.
grease and butter, that probably adds to it, you're right. This is where it gets a little bit deep, but just please stay with me, it'll get a little bit better after these next couple of slides. The pathophysiology part of the heart failure occurs, and it occurs is when the ventricles, or the bottom part of your heart, becomes stiff, and the blood does not fill appropriately in your heart, and then the ventricles eventually become dilated and loose, and they're ineffective. And that's according to Mayo Clinic. Systolic heart failure occurs when the left ventricle of the heart muscle lacks in contraction force, and so less oxygen-rich blood is pumped through the body, indicating that there's a heart pumping issue. The diastolic, the lower part of your blood pressure, the systolic is the upper part, the diastolic is the lower part, and try to get this to come down here a little bit. The diastolic occurs is when the heart contracts normally, but that the ventricles are stiff and less blood enters the heart, so there's not enough blood forced through the bodily systems. Some of those common symptoms seen with left-sided heart failure are fluid backing up into the lungs, which causes shortness of breath. Some common symptoms of right-sided heart failure may be that the fluid builds up in your abdomen, your legs, in your feet. Your feet become puffy and swollen. Oh, and if at any time you have any questions, just interrupt me and I'll try to answer those questions for you. Didn't move, did it?
Go to enable admin here up there. Can you click on that?
Sorry, I'm having some difficulties here. Hang with me, please. There are several different tests that your physician or cardiologist may order, and one of them is called the ejection fraction. And the ejection fraction is a test that measures how well one's heart is pumping. A normal reading is 55 to 70% under normal circumstances, and if that is ejection fraction is 35% or less, that means that there's a life-threatening condition. Other tests may consist of an electrocardiogram, an EKG, a cardiac catheterization, an MRI or a CT scan, and also nuclear medicines. However, sometimes the ejection fraction can be normal and you can still have heart failure. And that's according to Mayo Clinic 2015. Some patient barriers that exist for patients that are unable to seek treatment may be lack of self-care, lack of knowledge, comorbidities or other factors that play in with heart failure, other diseases like diabetes, or there are many other comorbidities that could add to heart failure issues. Lack of financial security, lack of family support, underinsurance, and lack of access to health care. I know in our rural area that we do have a lot of problem with patients that live out far. They don't have family members. They have difficulty with transportation to get to the doctor's office. So it does make it very, very hard for them to seek medical care. And then we talk about unhealthy lifestyle choices. They're smoking, obesity, hypertension, and physical inactivity are some of the reasons that produce heart failure symptoms, or that can lead to heart failure symptoms. According to Mayo Clinic 2015, all tobacco, whether it be cigar, pipe, cigarettes, cigars, all of it has chemicals that increase the risk of cancer and increases the risk of coronary artery disease. In your packet here, there is this form. Sorry, this one's colored, that one's not colored. And this talks about coronary artery disease. And that is, in a nutshell, the building up of cholesterol in the lining of your arteries, which causes plaque and therefore reduces oxygenation throughout your bloodstream and can cause heart failure, can cause chest pain, and it causes the arteries to narrow. Tobacco smoking, there is a pamphlet also in here on smoke out. There is some information here about resources that can help you quit. I know the health department here in Effingham offers a few weeks of patches free to those that sign up for smoking cessation classes. And there are also options of gum and lozenges and patches and pills, and also behavioral counseling that will help with smoking cessation. Because smoking increases your risk for coronary artery disease. Also, obesity, there are another sheet in here about from the World Health Organization, and this talks about 1.9 billion adults 18 years and over in the U.S. are overweight, and of these, over 600 million are obese. And obesity rates have more than doubled since 1980 to the year 2014. Obesity increases your risk for cardiovascular disease, diabetes, joint disease, osteoarthritis, musculoskeletal disease, and some cancers as endometrial, breast, and colon cancer from obesity. One of the guides in your packet, Eat More, Weigh Less. This is associated with the DASH diet, and it talks about alternative ways to cook, to reduce your calorie count, to help reduce hypertension rates, to reduce sodium rates, to increase fiber and in your diet. This is a really good resource, and it also talks about to have items such as broth-based soups before your meal, because that helps you to be more full, to feel, sensation stomach to feel full. To have low-fat or fat-free milk products, to have whole grains, beans, legumes, and lean poultry, fish, and meat. They always want you to remove the skin from the meat, and of course they don't want you to have it deep floured and deep fried. They want you to cut out fried fatty foods. They want you to eliminate or reduce high sodium foods like ham and bacon and your cold cuts, and dry snack foods that have a lot of salt. They want you to reduce or eliminate. Those are things like pretzels, cookies, chips, and dried fruit are sometimes high in sodium. Sugar foods, of course, this is not a diabetic diet. This is just for low cholesterol, reducing hypertension, and want you to cut out margarine, butter, candy bars, cakes, and pastries, the white flour. Here is options from one versus the other and the reduction of calorie content. It says chips or pretzels, like 1.5 ounce of pretzels has 162 calories. And if we would substitute that with baby carrots and hummus, 16 baby carrots with 1 tablespoon of hummus equals 75 calories. So that's a pretty big difference, and that's just one example of what's on here. So I'll let you read through that. And then this one is the DASH diet eating plan, and DASH stands for Dietary Approaches to Stop Hypertension. And that's all right. And in this pamphlet, it will give you options, cooking options, and like we say, it goes for reduced sodium, tips on getting started, the first steps, where's the sodium, and it shows you label reading in the back, how to read a label, food labels in the grocery store. I know that they're hard to read, so sometimes as we get older and my eyesight fails, it's important that we take a magnifying glass with us to the grocery store so we can see and read those labels. And the sodium contents, and it shows an outline of fat, sodium, and sugar and protein content on the label. It gives you an example to go by. So that's in your pamphlet. Some consequences of obesity, like we said, is heart disease, stroke, diabetes, osteoarthritis, and some cancers. And diet restrictions of sodium is a vital factor for patients with heart failure. Fluid retention will increase if you have large amounts of sodium in your diet. That's where you see a lot of swelling in the feet and ankles, your fingers will swell, your rings will get too tight. And I have on the table here a couple of no salt and low salt items. And on that seasonal, which I'm not endorsing any products and I'm not being biased here, can't do that. But anyway, the seasonal, it says it's 25% less sodium, but it's still very high in sodium content. The no salt or salt-free product is a good alternative to salt. However, you have to be aware that if your potassium is high, you have to check with your doctor first before you add these products, because that is a potassium-based product and it will increase your potassium level.
So even just a little sprinkle of it could add to it. I mean,
Well,
are you talking about a bunch of it?
I would double check with your lab value. Your doctor would probably want to check your potassium level in your blood before you add these products, because depending upon your kidney function and things like that, just to be on the safe side, I think it would be best if you talk to your doctor about it. Mrs. Dash, they endorse Mrs. Dash really big because it doesn't have any sodium. Take a guess. How many milligrams of sodium do you think is in 1 teaspoon of salt?
Well, this says low sodium on here, 25%.
I'd say 2,000.
2,400.
Wow.
Yeah, 2,400 milligrams in 1 teaspoon of salt, which is amazing. And all this salt is added during processing of your food. That's before you're adding any, so it is,
Salt shaker off the table is a really good idea.
yeah,
Because you're
taking
just
this,
adding more.
that's
Now, do you
right.
think there's a difference with sea salt? Is there any other benefit to that?
I'm glad you asked that. In fact, I researched that because I thought that would fit in with this information. Sea salt has a larger crystal, but it still has approximately the same amount of sodium content as regular table salt. And I know there's different varieties of salt, like there's pink salt, there's Himalayan salt, there's all kinds of specialty salts, but it's salt, no matter how to shake it, yeah. However you shake it, it's still
Nutritionally, it's
salt.
all the same.
It's pretty much all the same, yeah.
So they suggest Mrs. Dash is the best alternative.
They do, yeah, Mrs. Dash. It has more herbs and flavoring to season your food. And also, there are packets of no sodium bouillon that you can get, and I've seen that at local supermarkets. And that is good that you can get. It's no sodium. You can get chicken flavor, beef flavor, and then you can cook your vegetables in it to give it more flavor, or your meat products to add flavor to your meat products. Okay. Then I want to go to this, and I think this is called the stoplight tool, and I think this is the most important item that we have here. And this is what it is in your guide, although yours is black and white and it's on the left side of your folder. This, I did a clinical rotation with chronic disease nurses over 40 hours approximately a few weeks ago, and I learned about a stoplight tool. This, if you can imagine a stoplight like out in traffic, and the top is green, the middle is yellow, and the bottom is red. And what this is, it categorizes symptoms that increase in severity. So the green is where we want our to remain, our heart failure patients to remain. This is our goal. That is, they have no shortness of breath, they have no signs of swelling, they have no weight gain, they don't complain of any chest pain, and they have no decrease in any ability to maintain their activity. So this is where we want to remain. It's important that they take their medications every day. It's important that they weigh themselves every day, because if there is a weight gain of 2 pounds or more, I'm sure that your provider, your doctor, your cardiologist would want to know that weight gain, because a lot of times they can adjust your medications to offset hospital readmission, and plus, decrease your symptoms that you're having at home. The yellow area is a caution area, and this is where you'll want to notify your doctor, because you're going to have weight gain of 3 pounds or more in one day. You're going to be more short of breath. You're going to show signs or symptoms of swelling in your feet, legs, or abdomen. You may have coughing. You may have to use more pillows to prop yourself up to sleep at night. And you may have symptoms of dizziness or passing out. And with these symptoms, you'll definitely want to notify your doctor as soon as possible so interventions can be made. At the bottom is the red zone, and the red zone is an emergency zone, or where you must call 911 to seek emergency treatment. This is whenever they have symptoms that it's hard to breathe, whether they're sitting or resting, the breathlessness does not go away. They're having chest pain that doesn't stop. They may have wheezing and tightness in their chest. They can't sleep unless sitting up. And weight gain, this says weight gain or loss of more than 5 pounds in 4 to 5 days. They may have confusion also. So those are symptoms that you'd want to seek emergency treatment for. The next sheet after your stoplight tool has areas that you can enter important telephone numbers. And you want to put your doctor's name at the top, your cardiologist's name. And this sheet is inclusive, where it's all together. You can grab this sheet and take it with you to the emergency room if that occurs, and that way this list is up to date. Also in the back here is the list where you put your medications, and that's very important. Self-management of heart failure is very important. It has to be proactive. Patient has to be willing to participate in these interventions to maintain a status of wellness. It says that they want you to understand why and when to take your medications and what the side effects of those medications may be. It's a good idea to keep a pill box with your pills in it. That way you can keep track here of, like, you know, if you would miss a day, and then you can look back and see. You can go by your med planner to make sure that you're being consistent with your medications every day. We want you to know how to reorder your medications in case your family member may be gone. That way you can order the medications for them. And they'll always want you to bring a medication list with you, like I said, to the doctor's office. It's important to have your vaccinations of flu and pneumonia vaccines. Normally the flu vaccine is every year. The pneumonia vaccine depends upon your physician's orders. But you should be up to date on your vaccines. And of course, adhere to the low sodium diet, the low salt diet. Some patients, whenever they are heart failure patients, they are fluid restricted, and the doctor would order only a certain amount of fluid that can be ingested in that day's time to help the heart not work so hard. Eating out is sometimes difficulty because a lot of foods are, of course, prepared in their kitchen and they're made with a lot of salt, so you have to be careful whenever eating out. It's important to keep a daily log of your weight, your blood pressure, and your pulse, and that would give us a consistent idea of either if you're gaining weight or losing weight. That way you have a log to go by. It's important that you have some type of physical activity. It's a good idea to set simple goals, maybe, you know, walking a few steps each day, not to overexert yourself, but you do have to have some type of activity, physical activity, and then make goals. Depression and stress can be a factor with heart failure, so it's important that you have mechanisms to de-stress, like listening to music, working on projects, reading a book, working on puzzles, watching your favorite movies, are just a few examples of de-stressing activities that you may want to do. Limiting alcohol is a good idea in those that have heart failure. This guide says no more than 2 to 3 drinks per week.
You mean I can start drinking that much?
Well, I didn't say that.
Usually be okay.
And another important thing is it's very important to keep your appointments with your doctor so then that way it can be regularly monitored. Okay, and then next to that is the yellow zone. There are also empty blank areas where you can enter information. This sheet talks about any of your medications, and whenever you enter your medications, it doesn't just mean medications from your doctor. This means like any herbal medications you would take, any injectable medications, any inhalable medications. All of those items need to be entered on your medication drug list. Heart failure symptoms also can be increased by substance abuse activities. Street drugs, things like that make your heart work harder, can add to heart failure symptoms.
What about caffeine drinks? What do you think about that?
Well, caffeine will increase your heart rate. I will do more research on that to find out if that contributes to heart failure disease. And I'll get back with you on that. That's a good question.
Well, if you think about, like, I mean, obviously drugs and stuff, but the Red Bull products, all those, you know, I mean, they you know, there's reports that they might have problems.
Heart
So,
symptoms
yeah,
from it. Yeah,
right.
yeah, you're right, because I know they are loaded with caffeine and it'll make your heart work harder.
I don't know if it goes on to long-term heart disease, but, you know, just wondering if it could have an effect on it.
Yeah, I wouldn't probably
probably not many studies yet on that.
Yeah, it'd probably be a good idea for heart failure patients not to have them, just to be on the safe side. I'd double check with your doctor just to be aware, but I don't think it would be wise for them.
So like soda alone doesn't have a lot of sodium in it, and like your
Mhm.
soda, Cokes and Pepsis, it doesn't contain a lot of sodium.
I think there's
It
some
does.
sodas, like maybe, A&W, like the root beer is like low sodium. There's one or two that have like low sodium, they advertise that, but
I think Diet Right products.
Diet Right, yeah.
I think
Diet
that's
Right,
the one
it.
that is sodium free, but I'm pretty sure it's sodium free, but, and then, there's some tips in the back on, how to use less salt when you're cooking, and that is, one of the guides here. Sodium free in heart failure, low sodium cooking, tips on using herbs and spices. Those are some other guides that are in your packet of information. What was that?
That's what
Heart failure and salt, yeah, that's a good one too. Also about blood pressure, there are different ranges of blood pressure. A normal person's blood pressure will fluctuate when you're nervous, whenever you have activity, your blood pressure will be slightly elevated. And when you sleep, it should go lower. So at different times of the day, whenever you
Excuse
take.
me, I'm gonna have to go.
Okay, all right. All right, thank you very much for attending. Here's your evaluation form, we can get that later. And so blood pressure will range, the best blood pressure is lower than 120/80. The pre-hypertension rates state that it's 120 to 139 on the top and 80 to 89 at the bottom number, so that's pre-hypertension. And then a high blood pressure or hypertension is rated at the top number of 140 or higher and the bottom number at 80 or higher. Oftentimes we don't have any signs of high blood pressure, and that's why it's called the silent killer. And the only way to find out is to check your blood pressure and keep a log of those blood pressures. And then it wants to know, are you at risk for blood pressure? And increased risk for hypertension, of course, is from overweight, family history, and if you have pre-hypertension. If you're African American, those are some risk factors that increase risks for high blood pressure. Okay, I believe I went through all these guides and information. Do you have any questions that I can help with?
I'm trying to help my father because he has heart disease. What can I watch for on a daily basis? Where do I look on him to see physical signs or?
Okay, that's a good question. A lot of times, whenever they have heart failure, you'll have a lot of swelling in your feet and in your ankles, below your knees. They may be short of breath. It's a good idea for patients at home if they'll elevate their feet higher than their heart, if possible, several hours through the daytime. Of course, to eliminate salt, you can rinse your vegetables, canned vegetables, to try to eliminate rinse some of the salt off of it before you cook your vegetables. Sometimes they will wear stockings that are compression stockings to try to help reduce the fluid. Specific ones are ordered by your physician, but you can also buy ones that are over the counter to help compress the fluid. Of course, you'll want to eliminate, like we talked about, sodium, and also like vegetable drinks, like the tomato juice drinks. Those are very high in sodium. Canned corn, cream corn, I had no idea. Cream corn is like 720 milligrams of sodium, like in, I don't know if it's a half a cup or a cup of cream corn. Pretzels are very high, lunch meats, so those things that you'll want to eliminate. if your grandfather has to like prop himself up with more pillows, he gets more short breath. You may hear him wheeze in his chest. That means that there's probably fluid backing up in his lungs. He may be a little bit confused, and so those are some symptoms that you may have whenever heart failure, the exacerbation may be coming on.
Thank you.
Sure. Is there any questions that you would have?
I think that you've done a good job covering. It's just also overwhelming when you're trying to help somebody, especially when you're trying to help with their eating. And you know, I think for me, just knowing that I can rinse the vegetables and that right there cuts some of the sodium out, little things like that, you know, because it's not such a huge change, you know. Everybody wants to have accessibility to grab salt if they want to have it and not be told, no, I can't have it.
Mm-hmm.
So little things like that, it sounds like adds up to a lot of milligrams of sodium you've saved.
Yeah,
So-
I think that'll help, yeah, reducing the sodium, that seems to be the main factor with heart failure patients. And I know it's gotta be hard to try to eliminate salt because it's in almost everything that you eat, that you drink. It's in milk, it's in bread, almost every item that you have that you see in supermarkets. It's just loaded with salt. Like the packaged noodles that you have with the seasoning packets that you put in there, loaded with salt.
I knew those were.
Yeah, TV.
The tomato juice surprises me though. I mean, like I would have never thought about that, like V8 and stuff
Yes.
like that.
Mhm.
But so they make it taste good, I guess.
I guess.
Yeah, it's loaded with salt.
But I mean, a raw tomato doesn't have sodium. So, I mean, there again, it's the processing.
Processing.
You know, the
Mhm.
processing is what's just running it, so.
Yeah, you're right. Any other questions or?
Thanks for coming and talking to us
You're
today.
welcome.
Thank you.
Thanks for participating. I appreciate y'all coming.
I learned so much.
Thank you. This is an evaluation. If you would all just take a few minutes, and I wanted to make sure that do you understand what heart failure is? That is the lack of oxygen that your heart can pump blood through your system. The importance of taking your medications daily. It's very important to help control exacerbations of heart failure. I know to weigh myself daily and to report if you have weight gain. You have to report to your doctor if you have weight gain. I understand what foods I should avoid. Of course, we talked about the sodium. And the goal to remain in the green zone, that's where we want to keep you and your family members within the green zone to sustain wellness. In the caution area, that's when you need to contact your doctor, you know, if they start to have those symptoms that's in your heart failure guide. And then if there's symptoms in the red area, then those are emergency symptoms. So you call 911 or go to your emergency room. So I just wanted to clarify that with you. Okay?
I think it'll be easier to remember too with the stoplight
I
model. You know, I think I can remember that much easier, so
Thank
I
you.
appreciate that.
You're welcome.
Now, did you make that up yourself?
Yes. Well, the stoplight tool was already created, but I just made this evaluation format for this community presentation class.
Do you need our name on here?
No. Thank you very much.
Thank you.
Thank you.
Thank you.